No one likes to lose their hair, and if you think losing it and thinning is an inevitable part of aging, think again. After years of research, tracking, and selfishly wanting to get in front of the aging process and keep whatever hair I have, I've done an extensive amount of research in trying to figure out the most effective game plan to try to preserve or even regrow hair. So make sure you watch this video all the way to the end, because I'm also going to share with you exactly what I do for myself. I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. This topic is really near and dear to my heart because I'm 51, 52 right now, and right around the 40s, I started noticing that my hair was thinning. And I have a genetic propensity towards it because my father had lost a lot of his hair and his father lost hair, which took me on a journey talking to hair transplant surgeons, specialists, medical doctors in different fields, all to try to find out what is the state of the art and the best way of approaching this particular problem. So I've shared some initial thoughts on the topic in a very detailed video for women, which I think you should watch as well. This is going to be a little bit more of a practical guide, and in the end, you'll have a very clear 5-step action plan that'll put everything into the right direction for you. So without further ado, let's get into it. The first step in treating hair loss and hair thinning is to understand why it's happening. And this is specifically important for women. And it starts with laboratory testing. It's important because understanding the cause of it will save you not only time and effort and money, but it'll also get you to the root of the problem, which is necessary to be able to solve this riddle. And labs really will tell you whether this is a nutritional problem, a hormonal problem, or any other related issue. So for women specifically, this is where you want to start. And I'm going to talk specifically for men in just a moment, but let's put this laboratory testing concept into play. So the first laboratory test that is necessary, and there's a number of them, but first one is ferritin. Ferritin is basically your iron stores. Low iron triggers shedding even if you're not anemic. And the goal, or the number that you should be looking for, is between 70 to 150 nanograms per ml. So this is a blood test that you would take. In that same blood test panel, you're going to test your thyroid. And one of the tests you're going to look for is thyroid stimulating hormone, or TSH. And if the thyroid balance is off, the hair will fall out. The numbers you should be looking for is between 0.5 and 2.5 is where you're going to be hoping to land between. If you're above or below, you're going to have potential issues with hair falling out. In addition, you're going to look at free T3 and free T4. This is the thyroid hormone that's floating in your blood. This will show thyroid activity, the amount of active thyroid hormone that's out there. You want to be in the mid to high end of the normal range. Now, in very specific cases, and this might not apply to everyone, but total testosterone is also important. And in some women, they're going to have a potential endocrine issue or hormonal issue that increases the amount of testosterone. And in these cases, although rare, you're going to be looking for high levels that can cause temple or even crown thinning. So depending on the pattern, this might lead to doing this particular test. And obviously, you want this number to be within the normal range. If it's too high, that points to potential different approach. Most women have thinning of the hair behind the hairline, and so if you're starting to see the temple or the crown thinning, this is an indication that this might be the case. Once the testosterone is done, there's also another test that's optional, which is DHEAS, and this tells you if the adrenals are boosting the testosterone levels and where the source is coming from, and you'd only get this if you have an elevated testosterone. So in summary, for women, these laboratory tests are very important in terms of, again, getting to the root cause of it. Because you can see, they're gonna, if you have low iron, you increase the amount of iron. If you're not getting enough nutrients, this is all gonna help. So for women, it's a little bit more of a complex story that needs to start with laboratory testing. For men, it's much more basic. It's usually genetic, and it's usually related to DHT. And DHT is a hormone pathway of testosterone, and the patterns of male hair loss are going to be very specific, and they're very genetic in most cases. So once you know why hair is thinning, then you can take the proper actions to address it. Step 2 is to apply the targeted medical treatments. There are a number of FDA-backed medical treatments that are proven to effectively increase hair loss and even regrow hair, and more importantly, to prevent hair loss from happening. That's key. So if you're someone in your 20s and 30s and you know this is the direction you're going in, well, then you can keep the hair that you have on your head. And if you're a woman in your late 40s and 50s and you want to prevent the hair from being lost, these are some measures you can take to keep your density. So for men, the gold standard for hair preservation and hair regrowth is Finasteride or Propecia. Typically, the dose is going to be 1 milligram per day. Finasteride is used for prostate hypertrophy, but in much higher doses. In this case, for men only, you would use Propecia as a first-line treatment. It blocks the DHT, which is the root driver of male pattern hair loss. Now, in 1 to 2% of cases, there are some sexual side effects that can be seen, so you want to watch out for those. Otherwise, it's generally a great long-term treatment and very, very effective. So this is kind of the top of the line starting point for hair regrowth and prevention. But this is specifically for men. For women, in a very specific type of condition, which your doctor should be able to diagnose according to the test that you've taken, spirolactone is sometimes offered as well. Typical doses are between 50 to 100 milligrams. Spirolactone is another one of those drugs that are used for other purposes, but it's been shown to improve the hair condition in people with high testosterone. So this is very specific to those who have the high testosterone or have polycystic ovarian syndrome. And the things to look out for are dizziness and lightheadedness, which could be from decreasing your blood pressure. You need to carefully monitor your potassium levels if you're on this particular drug. Next up is Minoxidil. Now, Minoxidil can be used both for men and women. It's a topical treatment, which you basically use it twice a day on your scalp. In addition, there's an oral variety that has become extremely popular recently. The topical variety typically is around 5%, sometimes a little bit lower for women, and it's used to boost the blood flow to the follicles and increase hair loss and prevent hair from falling. Now, in the initial stages, it's normal to have some hair shedding as you push the hair into a growth phase. And in some cases, people do have some scalp irritation to it, although these are rare. Oral minoxidil, like I said, is becoming more and more popular, and doses in that case range from 1.25 to 2.5 milligrams per day. This was a traditional blood pressure medicine and has been found to increase hair growth. Typically, you want to start slow and low. Watch for some of the side effects, which are swelling or dizziness, and even facial hair growth you can see. And some people have issues with fluid retention and tachycardia and headaches. And again, generally very well tolerated, but some people, like any drug, can have some side effects associated with it. Now, let me share a quick anecdote on oral minoxidil. I had a patient not too long ago that I was marking up for surgery, and I was looking at her hairline, and she literally had like almost a 2-centimeter area in front of her real hairline, a bunch of hair, small hairs growing through. And I asked her about this, and she said, yeah, for the last 4 months or so, she started oral minoxidil at a dose of 2.5, and all of this growth was pushing through, basically bringing her hairline forward. I've seen this type of thing not only in patients, but also friends of mine and 20, 30-year-olds who are starting to see some hair loss happening. They're on the drug and seeing incredible resurgence of hair after that period. So it's really, I think, a promising good drug to use and effective. Like I said, I've seen it personally with my own eyes. It seems to be a bit more of a popular drug, the oral version, in addition to or in place of the topical version. Now, in the topical variety, you can also have compounded drugs that include finasteride in them as well. So finasteride is for people who are wanting to avoid the systemic effects and potentially decrease the risk of sexual side effects. The topical version of either finasteride or duestride or even a combination is very effective for getting those targeted areas. This has become more and more popular as well. And I'm going to talk to you about my personal experience with it as well as what I actually use. For women, you definitely don't want to use any finasteride, whether it's topical or oral. So this is one of those that is specific for men. But the topical minoxidil is definitely a good option. You can even take that in addition to the oral version as well. Okay, so those are the medical, prescription drugs that are used, and they're considered the first-line treatments, the most effective for basically preventing the hair from falling and regrowing hair. This is where you should generally start in terms of addressing the problem. Now, hair grows slowly, so you want to be on these for a minimum of 6 to 12 months before you determine whether you're having efficacy. In fact, with Finasteride, the long-term effects of it can take up to 3 years to fully see the effects of Finasteride. But of course, you're going to start to see all of this stuff working between 6 to 12 months. And a great way to see the progress is to take monthly photographs in the same lighting, same conditions, so you can see changes. But most people know that their hair is starting to grow. And everyone that I talk to who's on these drugs say immediately they started to see, the changes happening. Little hairs starting to grow in areas, the density is improving, etc. Now, I will say one thing about these meds is that when you stop them, you basically go back to where you would have been if you were never on the drugs in the first place. So you lose all that ground. So these are things that you're going to be doing over the long run, or else you're going to go back to square one and basically lose all the gains that you've made. So that's the only caveat and downside of these meds. But again, this is a commitment you need to make for the long run if you're going to go down this road. So medications lay the foundation, but we can push even further. Step 3 are regenerative approaches and also supplements that can help support and enhance the effects of these drugs. And the focus here is to improve the quality of the hair, the thickness of the hair, and really keep the hair kind of pushing into that growth phase. So think of this as feeding the roots and reactivating dormant hair cells. So here are some tools and supplements to consider adding on to your medical treatment. First on the list is microneedling. You do this at home, you roll this microneedling device across your scalp, creating 1 millimeter deep penetration, and you do this about once a week. And what this does is it creates microchannels that wake up the follicles and boost the topical absorption of the products that you put on top of it. This is sort of a do-it-yourself at home, but it's really important to sanitize those rollers after every use. Now, I will say some transplant surgeons don't like the idea of creating any type of trauma around the hair follicles, but doing it at such minimal depths are probably okay, but after 3 months or so, if you're noticing that you're either going into a shedding phase of your hair, definitely want to stop this from happening, because that might be due to the trauma that this is creating. But other people totally swear by it. I have a close friend of mine who does this, and I've been shocked at how dense his hair has gotten with the use of the topical treatments as well as the microneedling. Next up is laser caps. So laser caps are devices that have all of these LED lights on the inside. And what this does is you put it on your head, and what the LED is doing is it's basically getting right into the hair, and it's stimulating the hair follicles to go into a growth phase, as well as getting the increased blood supply and overall health to the skin. So this is something that has been very clinically tested. A lot of papers have been done on this, and most transplant surgeons that I've spoken to strongly believe in the use of the LED laser cap. So these type of laser caps typically are done depending on the brand. This one is called a Capulus. This is a new one that I just bought, and this is done for 6 minutes a day. Some of them are where you're using them between 15 to 30 minutes at a time, 3 times a week or every other day. So depending on the number of lasers, this particular one is designed to be the most powerful. It's given directly from a medical office. So new for me, but I love the fact that it's only 6 minutes a day. I wasn't loving leaving something on my head for 30 minutes every other day. So I like this particular brand, and it's used for both men and women totally safely. All right, so next up is PRP injections. PRP injections are done initially doing between 3 to 5 back-to-back sessions, typically every 4 to 6 weeks, and then you go on to doing it every 3 months. The idea here is that, bringing in those growth factors can jumpstart dormant follicles, and the results are temporary but can be very effective in some people. Now, it's uncomfortable getting the injections. Obviously, someone's putting a needle into your scalp and doing it all over your scalp can be definitely uncomfortable. And it's generally considered something you want to do in addition to either the other treatments that you're getting done orally or with the use of a laser cap, and not necessarily something you would do as a primary treatment. And the reason for it is the results are temporary. Once you're doing it and you stop it, it's basically you go back. So you don't have anything on a baseline level that's continuing to build the follicular strength and the dormancy and the growth phases with this. And interestingly, one of the transplant surgeons that I spoke with is strongly against the use of, again, the needles being stuck in the scalp because of potentially putting the hair follicles into a dormancy phase where they shed and then they kind of stop growing because of trauma. And you can understand that that might be concerning if you're getting a bunch of injections in there, and he's something that he's seen and typically is temporary, but again, you know, it has its pros and cons, and I know a lot of people who have gotten great results with using PRP in addition to, but it's not considered a powerhouse in and of itself. Next is core supplements. So these are things that are gonna fill in common deficiencies. So biotin, 2 to 5 milligrams a day. Vitamin D, 2,000 units a day. Collagen, 10 grams a day. Omega-3, 1,000 milligrams a day. These are things that have effects on skin, nails, hair. Make sure your diet is including them. If not, use some supplements to get up to level on these particular vitamins and proteins. Now, speaking of protein, this is something that comes up a lot. People who are low on protein can see hair shedding. You know, if you're a vegan diet, a vegetarian diet, and you're not really concentrating on getting the proteins, you could be deficient on protein, and that could lead to hair loss. So the general consensus is, talking again to transplant surgeons and specialists in the area, you need a minimum of 50 grams a day, ideally up to about 100 a day in terms of protein. Doesn't quite matter if it's coming from plant or animal based, so if you're a vegan or vegetarian, make sure you supplement the right way. So the idea is without the protein, you don't have the building blocks to support the growth that you're stimulating with all these other treatments. So make sure that you're getting the right amount of protein every single day. So with new growth on the way, let's make sure that the scalp is properly taken care of and is in good condition to support all of this. Step 4 is daily scalp care. Now, this is something I didn't quite understand, and I think it's helpful to put it into perspective. If your scalp gets oil buildup, sweat buildup, set up for an environment where you could get fungus or bacterial infections, all of that is going to lead to a decreased follicular health and ultimate hair growth. Because if the scalp isn't clean and in good condition, and there's inflammation from a number of different sources, the topical treatments and the different treatments that you do won't even get to penetrate into the scalp. So as a result, you're basically wasting your time. So let's look at what you should be doing for your scalp every single day. So in the mornings, gentle cleanse if oily with a sulfate-free shampoo. This is key. Sulfates can dry the scalp, etc. So make sure you're using a sulfate-free shampoo. And frequency should be every day or every other day. Scalp massage. You should set a timer and do a minimum of 1 minute of scalp massage. Now, this could be with your fingers or it could be with a brush, but you want to do this daily. This increases blood flow and all around good for your scalp. Again, in the mornings, you want to make sure you apply your compounded topicals or your minoxidil and use them as prescribed. In the evenings, rinse or wash your hair if you've gone, working out or gone to the beach, etc. Using, again, the same gentle shampoo as needed. And taking it really one step further, you might even consider using a silk pillowcase to decrease the friction on the scalp when you're sleeping. So some action steps. Make sure you switch out your shampoo to something that is pH balanced and sulfate free. Massage your scalp every day and make sure you don't tie your ponytail too tight, and you keep the heating measures that you do, blow drying or anything, below 300 degrees, because that can also lead to some damage to the follicles. Hair health isn't just about topicals, it's also about your lifestyle, which drives the hormones behind hair growth. Step 5 is to really commit to a healthier, better lifestyle. Poor sleep, too much stress, poor diet, all of these things lead to an unhealthy overall being, and as a result, the hair is going to show it. All right, so what things can you do? So number 1, make sure you're sleeping between 7 to 9 hours a night, because growth hormone peaks at night. So get your room nice and dark, get that melatonin secreting, same bedtime routine every single day. All of these things will ensure you get a good night's sleep. Stress. Cortisol, which comes from stress, shoves follicles into a shedding phase. So make sure you're doing things that decrease your stress in your lifestyle, breath work, daily walks, exercise, things that are going to decrease your stress and just, state of mind even. Diet. We talked about protein. Sugar spikes and inflames follicles, so decrease the amount of sugar in your diet, and also focus on increasing your protein and greens and healthy fats like omegas, etc. Exercise boosts circulation and hormone balance. So 150 minimum minutes of cardio per week, exercise and resistance training, all of these things are excellent for supporting hair growth. Gut health is one of those newer concepts that is so important because if you have poor gut health, you have poor absorption of the nutrients, low iron and B vitamins, which are totally necessary for hair growth. So make sure you're adding probiotic foods and limit alcohol, all of which can negatively impact your gut. So important action steps: decrease your stress, enhance your diet, improve your exercise activity. Obviously, all these things are gonna have major impacts, not just on your hair, but on your skin and your health overall. So these are important steps to take no matter what. Once you've done all of these things, and most good hair transplant surgeons will almost require you to start with this entire lineup. This has been my research that I've had talking to different doctors, and the good ones will say, you know what, try all of this stuff first. Do these things for at least a year. See how much hair you can regrow. See what the density will look like after this point. Because in so many cases, medical treatment alone is all that it takes. Medical treatment plus these lifestyle modifications. Then, if all else fails or you're still not quite happy with the density you have, whether you're a man or a woman, then you can move to hair transplants. Follicular unit extraction, which they take little bits of hair from the back of your head and put it here. These techniques are applied both to men and women. There's obviously strip techniques that can be done for higher density hair loss that can be applied to both men and women as well. But at the end of the day, these are reserved for after these treatments. But good news is they're highly, highly effective and ultimately can be used in both genders without any issue. And really, frankly, no matter what, again, good transplant surgeons are going to ask you and require you to stay on these medical drops and oral finasteride and lifestyle modifications, etc., no matter whether or not you get a hair transplant. Hair transplants are going to, put in new hairs, but you want to prevent the hairs that you already have from being lost, so that balance can lead to a net gain over time. But at the end of the day, know you have hair transplant in your back pocket that can always be used if these things don't get you to a satisfactory level. All right, so I'm gonna share with you what I currently do, and this has evolved over time, and this is just what I'm doing actually right now, and it's different than what I was doing about a year ago. It's become a little bit more complex, and some of these things I'm literally just starting. Here's what's going on. I use the laser cap, as I mentioned. I've been using that for about 10 years, a different brand than this current capulus. In addition, I have always been on top of my supplements. I've used topical Minoxidil, but I haven't used Propecia, and I didn't use compounded meds. So here's what I'm now doing. So number one, I'm washing my hair daily with that sulfate-free type of a shampoo. Two, I'm using a compounded concoction of Minoxidil, Finasteride, Duesteride, Retin-A, and a steroid, which decreases inflammation. So this is made by a compounding pharmacy, and I use those drops twice a day. In addition, I just started about 4 months ago on oral Minoxidil, 2.5 milligrams. I started doing this. I think it's starting to show some effects. I feel like there's a slight increase in density. And literally just this last week, I decided to give oral Finasteride a try. So oral Finasteride, 1 milligram a day. I'm gonna see how it goes. And the recommendation is to do this for about a year and then see how the hair is looking. And if it's enough density or it's keeping things in check, I'm gonna hold off on getting a hair transplant. And the reason why I would do it is, again, to preserve what I already have and to thicken a little bit of the loss that I've seen over the last 10 years. Now, I think if I didn't do these measures, like I said, if I wasn't on drops and didn't do these things for the last 10 years, I think I'd have a lot less hair than I currently do. I think the Minoxidil plus the laser cap, et cetera, has held things in check for a while. Now I'm hoping to get a little bit more out of it. I'm obviously very, very on top of my diet. I take care of all these things, the stress, lifestyle, everything else. And I've tried PRP, but I don't think I'm gonna continue on because it's between the discomfort and needing to do it all the time, and it's enough of an inconvenience to not want to continue on with it. But again, people have great outcomes with it. So I'm taking a little bit of a double down approach on the oral and topical Minoxidil, oral and topical Finasteride, and laser cap. In a year from now, I'll report back and I'll let you know how that combination is going, but it's sound in terms of what is generally consensus recommendation for approach. And here's the key. At the end of the day, consistency is so important because if you're starting and stopping all this stuff, you're gonna get nowhere with it. You have to do these things over time in order for you to see the benefits. All of them are, again, long-term commitments because the minute you stop, you're going to regress, no question. I mean, that's already been established. So if you are in your 20s and 30s and you wanna keep your hair from going down the route that your parents or your family members have gone down, or you're starting to see your hair decrease in density, get in there and start this process. Now, what's fascinating and what's amazing to me is when I speak to some of these experienced transplant surgeons, they say even if you've lost a lot of your hair, you can actually regrow a lot of it using this approach. So this is definitely not something that is like if it's, the ship has sailed, you can't do it at any stage in the process. You can actually get things going again. So don't lose hope. Don't feel you're out of luck and the only option for you is a transplant or to go completely bald. You're gonna be fine. You have options before you get to that point. But my biggest thing with my kids and any member, preserve, prevent, keep things from going down that direction. All right, that does it. That concludes the up-to-date topic on hair. Make sure you drop a comment below if you've tried some of these things. I wanna hear your experiences, what you've learned, what you'd like to share with us. Again, we're a community. We wanna learn from each other. I'd love to hear from you. If you enjoyed this video, make sure you like it. And also, if you haven't already, make sure you subscribe. Share it with friends and family. This is the type of video that you really want to get the word out as much as possible. And finally, make sure you subscribe to the Karam MD Journal. It's a free newsletter that I write every single week that it's delivered to your email. All right, folks, I hope you enjoyed it. Once again, I do this all for you. I want to empower you with information and knowledge. Until next time, Dr. Amir Karam.